Thank you all for joining us. This presentation will be with Skye Fitpatrick, PhD. We are very happy to welcome her back again this evening. This is the second time that Skye has done a presentation for us here at Sashbear, and she's also previously presented for the Ashley Boca Mindfulness Foundation as well. I will introduce Skye formally in a moment. I just want to once again welcome you all and go through a couple of housekeeping items. The first is that this is a webinar which is being recorded so that you can go back and watch it again later. We will have time for some questions at the end as well. So you are welcome to type questions into the Q&A and into the chat as we go along. Also, I just want to reassure everyone that as you join us, you are muted and your image is hidden from everyone. You will only be able to hear the people who are presenting this evening. So this presentation is being co-presented by the Ashley Boca Mindfulness Foundation and by the Sashbear Foundation. So the Ashley Boca Mindfulness Foundation was started by Diane Boca. And the ABMF, which you can find at abmf.charity, works to improve the quality of life for individuals impacted by emotion dysregulation, as well as the broad spectrum of mental illnesses associated with BPD. The Ashley Boca Mindfulness Foundation was founded by Diane Boca, Ashley's mother, and Ashley sadly lost her life to suicide as a result of having borderline personality disorder. So we want to remember Ashley and thank Diane for the work that she's doing with the foundation. The Ashley Boca Mindfulness Foundation has for a long time been great supporters of the Sashbear Foundation, where I work. And the Sashbear Foundation was founded by Lynn Curry in memory of her daughter, Sasha, who died by suicide in 2011, also as a result of borderline personality disorder. And so the work of both the Sashbear Foundation and the Ashley Boca Foundation really meshes nicely together. And we are happy to support the work that each other's organization is doing. I want to just let you know that this year has been a very successful year for the Sashbear Foundation in spite of COVID, in having to turn our work into an online presence rather than an in-person presence. In March, because of COVID, we nevertheless were still able to continue offering the Family Connections program to over 1,000 family members across the country, and to offer webinars and other presentations such as this online. So if anyone out there is interested in taking Family Connections within Canada, that's the program from NEA BPD, which is for family members of someone with BPD, you can go to our website at sashbear.org and look for more information there, add your name to the wait list. And our next sessions will be running in January, and hopefully we will be able to meet most of the demand. There is an increasing demand for the program across Canada. Also, we have been able to offer a number of webinars over the past few months, and I just want to let you know that we will have another great lineup for the coming year, which we'll be able to announce more in the future, but just to give you a teaser, on January 27th, we will have Carla Sharp, a psychologist from Houston, who will be speaking on mentalization and bringing skills and hope to family members through mentalization, which is an alternative treatment to dialectical behavior therapy. So she'll be speaking on mentalization, what it is, and how to do it. On February 3rd, we'll have Dr. Francesca Paraplechkova, who is the creator of DBTC, which is the specific treatment modality of bringing DBT, dialectical behavior therapy, to those who are younger than adolescents, children, which is why it's called DBTC. And the Ashley Boca Mindfulness Foundation also has webinars upcoming on January the 10th and February the 10th as part of their webinar series on mindfulness and on the key skill of validation, which if you've taken Family Connections, you'll know something about. So now I would like to just mention that I have Kathleen and Kathy with me here as well. I am Doreen, and we are all facilitators of the Family Connections program. And we're going to support Skye behind the scenes by answering some of the questions through chat as we can, and also to moderate the questions for Skye at the end of the session. So now I would like to introduce Skye formally, and thank you very much again for joining us, Skye. Dr. Skye Fitpatrick is the director of the TULiP Lab, the TULiP Research Lab at York University. TULiP stands for Treating and Understanding Life-Threatening Behavior and Post-Traumatic Stress. Dr. Fitzpatrick completed her PhD in 2018 at Ryerson, did a predoctoral internship in Seattle at the University of Washington, and a postdoctoral fellowship in the Center of Alcohol Studies at Rutgers University. Her current research interests focus on the examination of emotional and relationship processes in the treatment of BPD and PTSD, and identifying ways to streamline and refine concurrent treatments for this comorbidity. So Skye, thank you so much. You are doing such incredible work, and we are so excited to hear from you. So I'm going to stop sharing my screen there, and I think you probably have some slides that you would like to share.
I do, yes. So before I get those up, I just want to say thank you so much to Sashbear and the Ashley Boca Mindfulness Foundation for having me. It means a lot to be here. I wish we could all be in a room. I think I just got muted, so I'm going to talk again. No problem. It means a lot to be here. I wish we could all, I was just saying, I wish we could all be in a room together and I could see your faces, but it means a lot to connect anyway. And it means a lot to be here with organizations that are doing so much, not just for people with BPD, but their loved ones as well. I think we have a lot in common and in terms of the things we want to do. So thank you for having me. And thank you to all of you who have come. I'm going to share my slides. Thank you for that lovely introduction, Doreen. I don't feel like I have to say much to introduce myself now. Yes, my name is Skye Fitpatrick. I'm an assistant professor at York University, and I'm the director of the TULiP Lab, which is our very long acronym. What I'm really interested in is finding ways to optimize treatments for borderline personality disorder and post-traumatic stress. And recently I've become really interested in using relationships to do that. So when I was asked to speak on this topic today, it made me really excited because this is exactly what I think about all the time now. So what am I going to talk about today? So I'm going to start with just a quick review of BPD and how it's commonly understood. If you've been to prior webinars of mine, that might feel a bit repetitive. I won't spend too long on it, but I do want to make sure we're all on the same page. Then from there, I'm going to go and talk about the relationship between BPD and relationships. And specifically, I'm going to hone in on how loved ones are experiencing BPD. I think there's a lot of research out there on how people with BPD experience that. I'm going to talk about that a little bit. We know it's very challenging for people to have BPD, but there's less attention often paid to loved ones. So I want to pay a little bit of attention to them today. And then I'm going to end by talking about, okay, well, what are we going to do about all this? Like, what's the plan? And I actually share some of at least our plan and what I know some other people are doing as well. So let's start with how to understand BPD. This is my main message about how to understand BPD right now for the purposes of today's talk. I just want to acknowledge, like, having BPD is really hard. It can be really painful for the person with BPD. It can also be painful for loved ones. And I'm not saying that to blame people with BPD or loved ones. I just want to acknowledge that BPD has this way of getting in between people, in between the person with BPD and the loved one. And it can be really, really hard for both those people. And I'm going to unpack that a little more today. Okay, but what is BPD? Let's take a step back. So for those of you who are starting to just come to this diagnosis or understand this diagnosis for the first time, I just want to say a couple quick things to clarify some key pieces. So to diagnose BPD, normally there's 9 different diagnostic criteria in the DSM, the Diagnostic Statistical Manual of Mental Disorders, which is like the big book we use to make diagnoses in psychiatry and psychology. So there's 9 different things people might have. People need to have 5 of them to meet criteria for BPD. But we organize those 9 criteria into these 5 groups a lot of the time. And we see disruptions across these groups. So one of the first things that we often see is that people with BPD have some problems in their relationships. So often abandonment or feeling abandoned, or like they might be abandoned, can be really, really painful, can be very scary. And relationships can be really rocky. They are often really up and down. They can be a little bit hot and cold, but there's often a lot of conflict and a sense of instability in people with BPD's relationships. Another thing that can be a little bit up and down is the emotion piece. So we talk about this a lot in studying BPD, is that a lot of people with BPD have emotions that can feel very intense. You know, the famous expression is that some people with BPD feel like emotional burn victims, like things that are kind of a touch to somebody else can be excruciating to them. This really painful, intense emotional profile. And they often particularly have difficulties with anger, as well as sometimes chronically feeling empty. This deep sense of emptiness inside can also happen in BPD. One way that people often attempt to cope with negative, painful, intense emotions is impulsively doing things that might help in the short term to work with those emotions, but can actually kind of hurt in the long term. So that's the actions piece or the behavior piece that we sometimes see in BPD. This can involve things like substance use, binge eating, shoplifting, driving really fast, things like that, but it can also involve self-injury or self-harm or suicidal behavior or suicide attempts. So that's another piece we see in BPD. And then another thing a lot of people with BPD experience is a difficulty having a clear sense of self or who they are. They often feel like they don't really know what their morals or ethics or values are, or don't know who they are in the world or what they want for their life. That can be really, really hard for people. And then last, the cognition group that I'm talking about is that sometimes when emotions get really high for people with BPD and they feel really, really stressed out, they can experience some things called dissociation, which is essentially losing it can kind of feeling like all of a sudden the world isn't real anymore, kind of shifting into another state of consciousness. Sometimes people actually can't remember things. Periods of time. Sometimes they feel like they're not really in their body or things don't feel quite real anymore. And sometimes they're not dissociating, but they can start to have kind of paranoid thoughts. They can start to worry more about what other people about them are doing, kind of starting to assume that there's more harmful intention of others than there really is. And that can happen when emotions get really, really high. Okay, so those are the 5 clusters. So how do we understand this? Well, the most common models of borderline personality disorder, and the model, in fact, that dialectical behavior therapy is based on, for those of you who are familiar with that therapy, really takes that emotions cluster and puts it at the middle of all the other symptoms. Kind of looks like this. So the idea is that, you know, all these BPD symptoms are either direct outcomes of, directly, you know, a result of intense or labile, difficult emotions, having difficulty changing emotions, or their attempts to kind of regulate or deal with emotions. So if your emotions are going all over the place, if they're really, really intense, you do have more conflict, right? We all have more conflict with people in our lives when we're feeling more emotional, right? So that's not that unusual. Our perceptions of people change when we're feeling emotional. When I'm really, really angry, I have a lot more negative thoughts about my husband than when I'm feeling really, really happy. You know, that's just how relationships change with emotions. And I already mentioned that some people try and cope with these painful emotions by doing things that can hurt them, right? Doing things like self-injury or binge eating or substance use, because we know that for some folks, that gets those emotions down in the short term. In the long term, tends to make them come back. But in the short term, it might be a strategy that people have learned to deal with these feelings over time. Our emotions play a huge role in telling us who we are. Right? They tell us what we want to go towards, what we want to go away from, what we like, what makes us happy, what makes us mad, what makes us sad. In a way, that's how we form our sense of self, right? So when your emotions are going all over the place, it can be really, really hard to do that. And then last, dissociation, that state I was talking about, tends to occur in BPD specifically in response to rises in emotion. And we know, based on some research on what happens in the brain when people dissociate, that it tends to shut down emotion. It kind of is almost like a strategy of dealing with emotion kind of automatically. So it makes a lot of sense to think about emotions as like the center, the beating heart of all of these other symptoms, problems with emotions. I'm going to come back to that model in a second, but I want to pause for a moment and look at, well, how are loved ones experiencing this? So I've talked a little bit about how people with BPD might be experiencing these symptoms. What do we know about their loved ones? And what I want to be clear on about that is that BPD as a disorder has this tendency to wedge itself in between people, into relationships. Not that people with BPD are doing that on purpose. I want to be very clear that that's not what I mean. But that BPD can make it hard for people to connect. I often see it like you have the person with the diagnosis and you have their loved one, and it's like the BPD itself is like getting in between two people who want to connect with each other. So what is happening in people with BPD's relationships? Well, we know that relationships are more challenging for people with BPD, that people with BPD often do have relationships that have more arguments in them, more criticism in them, greater general dysfunction, so greater conflict, greater distress, lower satisfaction in relationships, and even at times higher violence in relationships. So we do know that relationships are struggling for people with BPD. So how are loved ones experiencing that? Well, unfortunately, there's not a ton of research on how loved ones are doing and feeling and navigating their world in general. The little bit of research that we do have suggests that loved ones also struggle, just like people with BPD struggle, loved ones struggle too. And sometimes that they have elevated levels of grief or depression or anxiety, that they also have a hard time controlling their own emotions sometimes, and might have elevated mental health problems, or just feel kind of worried about their loved one with BPD, or feel kind of disempowered or concerned. Again, I really want to be clear that I don't want to say that the person with BPD is causing that. Like, I just think that BPD is really hard for both people in these relationships. And we can see that in the little bit of research that has been done with loved ones. I was asked to speak specifically about trauma in loved ones, and I'm happy to do that because that is an area that I research. But one thing I want to say before I get into that further, and if you came to my last Sashbear webinar, you'll remember me saying this, and I'm going to say it again because it's important, is that before I speak about trauma, it's really important to understand that trauma and post-traumatic stress disorder, or PTSD, are two different things. Most of us experience trauma at some point in our life, something traumatic. Only a select portion go on to have PTSD, which is one specific problem that can follow from trauma. But it's not the only problem that can follow from trauma, and it doesn't always follow from trauma. So I do want to be clear that these two things are different. So what's trauma? Well, that's a really controversial question, actually, but in the DSM, which I was talking about earlier, the DSM has a very specific definition of what it considers to be trauma, which involves being exposed to some kind of actual or threatened death or serious injury or some kind of sexual violence, either by directly experiencing it oneself, so, being attacked or something like that, seeing it happen to somebody else, hearing about something violent or accidental happening to a loved one, or being repeatedly exposed to kind of extreme details of someone else's trauma. So think about like caseworkers or social workers who are listening to like the details of someone's trauma over and over and over again. This definition is controversial because a lot of people will say that they have experienced things that they felt to be traumatic that doesn't meet this criteria. I'm not here to say that's not trauma, that is trauma, or litigate that. I really think that the reason this definition is this way is at this point because these are the events that more reliably lead to PTSD. That doesn't mean that if something doesn't fit this criteria, it wasn't extremely difficult, extremely powerful, or more powerful than some people experience some of these events. This is just how the DSM defines it at this point. And for some folks, when they've experienced trauma, that can lead to PTSD. Again, not everyone. So really quickly, I will just say that PTSD involves 4 groups of symptoms that follow from trauma. The first symptoms are the intrusive symptoms, and that involves trauma kind of intruding on your life, having reminders of trauma like nightmares or flashbacks, memories of a traumatic event. The next group is the hyperarousal symptoms. So when you have all those intrusive symptoms, sometimes you get kind of on alert, on guard, heart starts to beat, starting to feel like you have to kind of watch out for signs of danger, stuff like that, feeling more irritable. That's the hyperarousal group. Avoidance involves avoiding things that remind somebody of a trauma, including their own thoughts, but also things outside of them, like going to specific places or talking to specific people. And then we have the numbing symptoms, which can involve feeling really disconnected from others and really detached. So I'm not going to talk about PTSD too much more, but I want to give you a sense that those are specific experiences that some people have following trauma. That's what we call PTSD, a little bit different. So let's come back to how loved ones are doing. Do we know if loved ones have PTSD or trauma? Unfortunately, we don't. There's not, to my knowledge, any research that looks at the extent to which loved ones of people with BPD experience trauma or experience post-traumatic stress disorder symptoms. But we have reason to believe that this may be a problem. Question mark, a little speculative. But we know that at least some of the things that are common in BPD that other people have seen or struggled with as a loved one have caused PTSD-like problems. So if we take suicidal behavior or a suicide attempt or a death by suicide of a loved one as an example, a lot of loved ones of people who attempt suicide do report PTSD symptoms. And in fact, we know that people who lose a loved one tragically to suicide are more likely to have PTSD after that loss than after the loss of a loved one to another cause. So we know that for some people, at least some things that do happen in BPD, like suicidal or self-injurious behavior, might have a relationship to PTSD symptoms in loved ones, but that's not been studied directly in the loved ones of people with BPD. So it's still a bit of a question mark. One thing I do want to highlight, though, is that this research also suggests that having support from family and friends is a big protective factor against these outcomes. So when something challenging happens, like a loved one attempts suicide or is self-injuring, having support from family and friends looks like protect people from developing PTSD. And that really speaks to the power of groups like Family Connections and having people around you that you feel like you can confide in and talk to as protective. So my thesis here is that people with BPD and their loved ones are both struggling. They're both struggling in their own ways, but they are both struggling. And I think they both need help and compassion based on what we know so far, which is honestly not that much. We need to do a lot more work in this area. So let's talk about the relationship between BPD and relationships. So I talked earlier about the idea that emotion is like the center of BPD symptoms, which is a great theory and a theory that I support and have spent a lot of time researching. So I'm not here to bash that theory. I think it's a really, really important theory. But I also think that there's some research that suggests that relationships are also really important for BPD. For example, in one study that followed people with BPD over 6 years, it showed that the people whose BPD symptoms improved were more likely to have non-distressed relationships or kind of functioning, healthy relationships than the ones whose didn't, which suggests that there's something about relationships that might be important to other BPD symptoms. So if we go back to that cycle of 5 symptom groups that I talked about earlier and think less about putting emotions in the middle, or in addition to putting emotions in the middle, we also put relationships in the middle, we might see a bit of a different picture. So first of all, we know across many different psychological disorders in many different mental health fields, having poor social support or having problematic relationships or difficult relationships is one of our most robust predictors of distress, of a range of mental health problems, and of something called emotion dysregulation, which refers to these disrupted, volatile emotion processes. So yes, emotions probably impact relationships, but actually relationships impact our emotions. How stable our relationships might be really important for our emotional health. We also know that it's true having, these impulsive behaviors, self-injury, binge eating, they can function to change emotion. They can be thought of as a coping strategy for emotion, and there's research to support that. But they also have other functions too. Sometimes people engage in those behaviors for reasons that aren't emotional. Sometimes it's to connect. Sometimes it's because that's how they've learned how to receive care. I'm not suggesting people are trying to manipulate or attention seek or do these things on purpose, but our systems learn to do things when those things get our needs met. So if somebody feels really disconnected and then all of a sudden they feel more care or connection and following something like self-injury, then, yeah, maybe their system will start to learn to do that more to get what they need. Our relationships are also critical to our identity, right? So we learn who we are from our relationships. We learn who we are by who we're around, by who we connect to, who we don't connect to, who wants to connect to us. So relationships impact those symptoms too. And although it's true that dissociation and paranoid thinking really come on in response to intense emotion, paranoid thinking that kind of happens when emotions get really high, it often involves thinking about other people. So that might be connected to relationships as well. So what I'm suggesting here is that relationships actually might be a bit central to BPD as well. And there's actually some growing research to support this. There's been studies that look at the extent to which people have larger emotional reactions than other people or other groups. And what some of that research suggests is that those larger emotional reactions are specific to interpersonal stress, that when people with BPD are stressed out by other things like a math task or something that doesn't involve other people, their reactions might not be so much bigger than other people's. And that really, it's in response to our interpersonal stressors, our relationship stressors, that emotions can get really intense. So maybe there's something about relationship stress that's particularly hard for people with BPD. We're not totally sure, but we're wondering about that. We also know that interpersonal and relationship factors play a role in some of the behavioral pieces that go along with BPD. So in BPD, 73% of the most lethal suicide attempts come after some kind of interpersonal event, like a conflict. And I did say that some people, people can engage in behaviors for all kinds of reasons. So some people might engage in self-injury to change emotion. Some people might do it to get their relationship needs met. Some people might do it for some other reason altogether. But having higher BPD symptoms predicts a higher likelihood that some of these behaviors, self-injury in particular, have some kind of relationship function to them, that people are doing it for some reason to get at least some part of an interpersonal need met some of the time. Might not apply all of the time. So what my research group has tried to do is look across the literature and synthesize really key ideas about what's going on in people with BPD that impacts their relationships and vice versa. And there is research that suggests that people with BPD tend to pay more attention to negative interpersonal information. So what I mean by that is if you all were here with me, if I was speaking to a large room of people and everybody was smiling and nodding and one person had a neutral expression or was frowning, I might be more likely, if I had BPD, I might be more likely to pay attention to that one frowning face, right? I think we all do that when we're nervous, but we see that a little bit more in BPD. We also know that people with BPD are more likely to interpret interpersonal information as negative. So if I saw that neutral expression, rather than thinking they're neutral or they're tired from their workday, I might think they're mad, they hate me, they hate this presentation, or something like that. And we know that what we attend to and how we interpret what we attend to influences how we react emotionally to that thing, right? So if I pay attention specifically to that frowning person, I'm going to be more likely to have a negative emotional reaction than if I didn't pay attention to that, or if I told myself something else about it, like, oh, that person's just tired or something like that. We also know when our emotions go up, it's really hard to communicate. And there is evidence to suggest that when people with BPD's emotions go up, it gets even harder for them to communicate effectively with the people around them. And this is often where we see unhelpful things to change emotion. So things like self-injury or binge eating or substance use or shoplifting or something like that. Those other pieces, they often follow these rises in emotion. So maybe those things happen because they get emotions down. And then for other people, they might happen because they get some interpersonal, some relationship needs met, some feeling of connection or something like that. Oops. So maybe if we think about it this way, BPD is an emotional problem, a problem that involves emotions, but it's also an interpersonal problem. It's a problem that involves interpersonal processes, relationship processes as well. I should say that a lot of these individual components have been tested, but to date, there hasn't been a test of this whole pathway at once, which is something that my research group is interested in doing in order to figure out if we've got it right here. Okay, so just a few more things I want to say about that, though, is that I just talked a lot about, okay, well, what's going on inside the mind of somebody with BPD? Maybe, possibly. It's really important to remember that nothing happens in a vacuum, right? None of us exist in a vacuum. I'm impacted by the person next to me. I impact them. And the same thing happens for people with BPD. A person with BPD is in a relationship to somebody else, to a loved one, to a family member, to a friend, to a partner. And they impact that partner and loved one, and that loved one impacts them too, right? And all of those people, all of those relationships are impacted by broader societies, like what's going on in our society, what's going on in our pandemic, what's going on in politics right now. Like those things all trickle down and impact our relationships and each other. So we're all kind of connected in that way. And I just spend a lot of time unpacking, what do people with BPD might pay attention to? How do they interpret things? How do they feel? How do they act? But also, loved ones also have their own attention processes. They have specific things they're going to pay attention to. They have specific ways they're going to interpret things. They have specific emotional reactions. They have specific ways they're going to act. And what I'm positing here is that those two things influence each other, right? What a loved one is paying attention to is going to influence what someone with BPD is paying attention to. How they interpret things, how they feel, how they express emotions, going to influence the emotions and expression of emotions in the person with BPD. And vice versa, right? We all impact each other. And this is what I mean in this broader relationship. It's kind of like BPD is in between people, right? Like the transactions themselves can maybe pull for some of these pieces that end up feeling so destructive. And I'm going to unpack I know that's a little abstract, so I'm going to unpack what I mean right here, right now. I'm going to present some ideas that are a little speculative here. So I do want to be very, very clear. The specific ways loved ones think and act and feel has not been studied very much, if at all, in the research at this point. So my research group has some theories that we're kind of working out right now. But I'm not presenting based on a mountain of science, which is what I usually like to do. So some of this is a little bit of a theory or a guess based on what we know so far. And I do want to be clear about that. So I already talked about the idea that people with BPD are more likely to pay attention to kind of negative interpersonal signs. So something that's around you, pay attention to some sort of negative information. Loved ones might do that too, or might be, if you have a fight with your loved one, or if you've had a really hard time with your loved one with BPD, there are specific things you might pay attention to. Are they upset right now? Did I just make them mad? Or is everything safe over there, right? So signs that things might be going wrong, any of us in conflict, when we have conflict with our loved ones, start to pay more and more and more attention to signs that we're about to have more conflict, or signs that things are going to go wrong again. So in that way, kind of negativity begets more negativity in relationships. So maybe the person with BPD is likely to interpret information as negative, or in a negative or threatening way. But loved ones are going to have their own beliefs too, right? What does it mean when I see my loved one with BPD have this big emotional reaction, right? If you've seen a loved one have a big emotional reaction that leads to something kind of catastrophic, like self-injury or a suicide attempt or a big fight, next time you see them having a feeling or emotion, you might be really, scared, or you might be angry, or you might want to just shut it down or get away from it altogether, right? Or something like that. Just like if somebody with BPD just had a fight with you and didn't connect with a loved one or something like that, and then they see signs that there's a disconnection in the relationship, they might also have those kinds of reactions, might also feel like, oh no, something's gone really wrong. So both members of the relationship might have their own beliefs that lead to emotional reactions, right? We all have emotional reactions, and we can get really sensitized, especially when our relationships aren't going well. We can get really sensitive to what our loved ones are doing. And when we have emotions, it's really hard to communicate. And when it's hard to communicate with each other, what happens to all of our emotions, right? When my partner does not communicate with me effectively, my emotions go up. And then I don't communicate as effectively. So what happens to his emotions? They go up, right? So in that way, communication might start to get a little bit tangled. It might start to get a little bit difficult to share with each other what's actually going on, what you're actually feeling. And there we start to get a little bit of conflict. And yes, sometimes people with BPD might do something to regulate emotions, like fighting or self-injury or substance use. Not always. People with BPD don't always do these behaviors. But for those who do, that influences, first of all, that influences their own emotions in the long term. That also often can be painful for them in the long term in terms of what they're feeling. But some of those behaviors are hard on loved ones, right? A little speculative, but I think it's probably fair to say, based on the literature, that seeing some of those things happen, those destructive things like self-injury or suicide or binge eating or substance use, can be hard on loved ones and can scare some loved ones and make them maybe more on guard for signs that that might happen again. And in that way, we start to see possibly, we haven't tested this in full yet, but we possibly start to see a cycle, right? Now you're going to be paying more attention to these signs or something like that. And when a loved one has a hard time communicating to the person with BPD, that also might influence the person with BPD's sensitivity to the idea that something negative is going to happen again in the future, right? If you have a conflict with somebody one day, you're more on guard for signs of conflict the next day. You're just feeling a little less easy. So in that way, my research group has been wondering a lot about whether these things operate in a cycle. As I said, we still need to test this full cycle because there's not a lot of research on loved ones and the way they're experiencing things. But you could see how these things kind of start to spiral out of control, not on purpose from the individual with BPD or from the loved one. These things just get away from us when there's a lot of emotion in the mix. So what are we going to do about it? If that is true, what are we going to do? So I have a couple of thoughts I want to share. The first thing that I want to share is there are interventions for loved ones of people with BPD. Family Connections was mentioned. Sashbear is such an incredible advocate for family connections. These are psychoeducational based and skills training groups for family members of people with BPD. And they have been studied. There's research to suggest that they are helpful for the mental health of loved ones, for depression, anxiety, for helping loved ones feel more empowered and more mastery and accomplishment, which is great. There's also other groups like this, another one called Family Skills Training, which is a similar group. If you're interested in family connections, I believe Sashbear has on their website a way to find family connections groups available near you. And there are interventions for BPD and their loved ones. So some versions of dialectical behavior therapy, especially if the person with BPD or BPD symptoms is an adolescent, incorporate family members. And there are other treatments. There's one called STEP, Systems Treatment for Emotional Predictability and Problem Solving, which incorporates loved ones into it so that both the person with BPD and their loved one can learn some skills to cope with difficult emotions and distress. What I will say, speaking on behalf of my research group, is what we really want to do, because we are worried about people with BPD and we are worried about their loved ones, is we really want to find a way to both promote BPD recovery for people with BPD and enhance relationship functioning at the same time. So I am so thrilled on that note I will just say quickly that we are launching our first study to test a new intervention that our group has developed for couples where one person has BPD and struggles with self-injury or suicidal thoughts or feelings, called Compass. We are just getting going launching that. We don't know if it works yet. We've just developed it. If people are interested in that, they can email tuliplab@yorku.ca for more information. That's all I'll say about that for now. But one thing I do want to say more broadly is that one of the reasons we think that we can do that as members of our research group have developed similar interventions for other disorders. So a member of our research group specifically developed a therapy called cognitive behavioral conjoint therapy for PTSD. And this is a therapy, it's to treat PTSD, not BPD, but it's a therapy that's delivered both to the person with BPD and a loved one at the same time. And it's been studied in 9 trials now, and research suggests that it improves PTSD to about the same extent as our gold standard treatments that are individual therapies, but it has these added benefits of also enhancing relationship functioning and improving loved ones' mental health as well. So we're really interested in trying to find a way to do a treatment that does something like that for BPD, and we are hopeful that we can, but the jury's out. We'll see. Ultimately, I share these things just in the spirit of naming that I think that there's a bright road ahead for people with BPD and for loved ones. I think that we're starting to understand this, and more people are starting to pay attention to the way loved ones experience BPD, just in the same way that the way individuals with BPD experience it. And there's increasingly a lot more researchers that are starting to study ways to help loved ones. So if there are loved ones out there, I do want you to know, you're not alone. We're thinking like from the research end, we are thinking about you. I'm thinking about you, and I'm thinking about you too for people with BPD, and trying to find a way to try and come at all of these issues at once. And I'm really hopeful that we will figure out a way to do that. And what's already available is pretty great too, in terms of family connections and DBT. So I'm gonna pause there. I see notifications from questions in the chat, so maybe I'll stop my screen share and let some questions come in.
Great. Wow. Well, this is absolutely fabulous, because yes, of course, now the the tape is rolling, as so to speak, as the questions come in. I have some really interesting questions that have come in, and I have reminded people that we can't really address the specifics of anyone's particular family situation, but that as we ask them, you'll try to sort of generalize the responses. So I have one question here. Do people with BPD tend to lean more to the avoidant attachment disorder side, or something different?
That is an interesting question. I am sorry, I do not have a lot of data to draw on for that question. So there is, for those who are curious, there is another personality disorder called avoidant personality disorder, which often involves, really strong fears of rejection and like a lot of anxiety about social relationships. Personality disorders in general are what we call highly comorbid, which means that they tend to co-occur. So there is research that suggests that there's a relationship between BPD and other personality disorders, but I don't know that I have, like, off the top of my head, a study that could readily say, yeah, it's more avoidant personality disorder than something else. That being said, I will say that, what's thought to be the core of avoidant personality disorder is often like shame and fear of rejection and negative feelings about oneself. And we do know that people with BPD struggle with that quite a bit.
Great, thank you. Maybe Kathy and Kathleen have been watching the questions too. I know I will ask one that came in previously, which was if there's any research done in a relationship where one person has BPD and the other has ADHD, or is there a relationship? Is there anything unique or that we specifically know about that type of relationship?
It's an excellent question. So as I said, one of the hallmarks of BPD is that it's a disorder with a high level of comorbidity, which means that having another somebody with BPD having another psychological disorder is really the norm rather than the exception, that they can be diagnosed with something else. So ADHD can be comorbid with BPD individually. In terms of having a relationship where one person has BPD and one person has ADHD, I'm not aware of any data that has looked at that. And part of that is speaking to the fact that, unfortunately, there's so little data on loved ones and how loved ones are doing. So it's a great question. I don't think it's been systematically studied, but it's a great idea. Maybe one day we'll get there.
It is a great idea. And in line with great ideas, I know a few people have been asking about the sibling relationship. And if there are any specific studies or if you anticipate any research being done specifically about siblings growing up in a household where their sibling has BPD.
Yeah, so the research that I am familiar with respect to how like loved ones and family members are doing is often very general in terms of like including anybody who has a relationship to people with BP, which includes siblings. I have not seen a study that specifically isolates siblings. And so the research that generally suggests that, yeah, family members have elevated mental health problems in general, I think would, that research has included and applies to siblings. What do we know specifically about siblings? I don't know that I feel like I'm giving a lot of this answer and I'm sorry about that, but I think it really reflects the nature of the field at this point and the importance of actually like of communities like this that are really trying to push for awareness. Like, I don't think that there has been a ton of research specifically studying siblings. So all I could really say is what we know about family members in general at this point. My group is very interested in changing this and really, really interested in specifically getting to know the experience of loved ones so that we can figure out how to best help them.
Okay, great. And interestingly, Abby has just sent me a note. Abby Ingber, who is the executive director of NEA BPD in the States. And so Alan Frizzetti and Lucy Payne, apparently, of the McLean Hospital affiliated with Harvard, are getting ready to do a sibling study. And I believe Abby can text me and let me know. But I believe that that would be around the efficacy of using a program similar to Family Connections with siblings and whether that would be an effective support for them. So that will be.
Yeah, and actually maybe since you've named Alan Frizzetti, who is another researcher who's been a pioneer in the research of understanding loved ones' experiences and the ways people with BPD and their loved ones transact. So thanks for bringing that name up too.
Yeah, great. And he was one of the ones who did the original research in developing the Family Connections program.
Yeah.
So, and speaking of Alan, then again, there's a question here. When the emotional reaction from the person with BPD is chronically emotional, also verbal and at times physically abusive, would the loved one not be susceptible to complex PTSD over a long period of time? And I know Alan has developed a Family Connections variant that is in the process of being studied and ruled out for family members who experience trauma because of their interactions with their loved ones. So I don't know if you have anything to add to that.
Yeah, sure. I can add something to that. I mean, yeah. So as I said, what we define as trauma, like, being violence certainly fits within that. And there's lots of things that are traumatic, and some events are more likely to lead to PTSD than others. And what we know about some of the events that are more likely to lead to PTSD are things that involve somebody close to you, like a family member, and often things that happen at times like earlier in life. So if somebody's growing up and is receiving a lot of violence, absolutely that could lead to PTSD. It wouldn't inherently lead to PTSD, but for many people that really could lead to PTSD. And the questions about complex trauma, which is a diagnosis that's talked about, it's not for, like, in the DSM in North America, although it is used in other diagnostic symptoms, or systems rather, which is sort of a variant of PTSD that involves more problems with emotion and relationships. I can't speak to that specifically, but I do think that, yes, of course, those kinds of behaviors can lead to PTSD. And of the general traumas we know about, those are some that are more likely to lead to that.
Great. Okay, and maybe I'll ask Kathleen if she has any questions that she's been saving that she would like to share and have you answer. And maybe while she's getting organized to do that, if I could just ask you to repeat how people might be able to get involved in research that you are doing if they feel they might fit the criteria.
We are updating. I'm laughing because I think my graduate student is here who's working on this, but we are updating our website this week. So you can go to tuliplab.ca to see what research opportunities we have available, or you could email tuliplab, which is just like how it sounds, the word tulip, TULIPLAB at yorku.ca.
Great, thanks.
Yeah.
Kathleen?
Okay, this is very overwhelming. There's so much here. So I'm going to focus my question on the adolescent and childhood age group. There's some concerns about, and if you can just give your thoughts on this, defiant disorder in childhood and later BPD, and then also OCD and BPD comorbidity. And then we have ADD and BPD, as well as for adolescents with BPD, is the peer relationship also quite significant, even more than family? So it's all that whole area.
Okay, so let me first start by saying, and again, I apologize, this is going to be a dissatisfying answer. I'm not a child psychologist. So my knowledge of families and adolescents and children is limited because I really focus on adults, and that's what I'm really competent in. So I can't really comment honestly too much on what's going on with kids. I'm sorry about that. What I will say, as I said earlier, comorbidity, the rule, not the exception in BPD. So mood disorders, for example, in some studies, up to 96% of people with BPD have a mood disorder as well, or have had one at some point in their life, whether that's depression or bipolar disorder. PTSD, about half of people with BPD have PTSD. OCD is not the most common comorbidity, but it is a common comorbidity. And ADHD is also a comorbidity that we do see in BPD. So if the question is, do those things co-occur? They do. That is not a wildly atypical thing that you would see.
Okay, so thank you for that. And the other question that kind of tails on this is, would this video be good for her to watch? Meaning a daughter. I don't have an age on that, but I think this is very factual presentation. It just kind of makes us aware, but would it be good for a daughter, a supported one, a loved one to watch? Oh, sorry, she's 19.
It's very hard. That's an excellent question. It's very hard to answer in the sense without knowing anybody in particular. Like, I think in a way, there might be people who have BPD here who might find this helpful, and there might be others that find it unhelpful. And I think it really depends on the person, what the person knows about themselves, and what the family member knows about that person. So I really, really think that that's a pretty personal thing that would really, I couldn't really say, I guess my answer is, I think it depends. Some people find this information really helpful. Just like when I've in the past, when I talk to people with BPD, some people find hearing about the diagnosis really cathartic. Like, they feel like they're not alone anymore. And it's like a relief to know that other people have these problems. And other people find it really upsetting to hear about, because also it is upsetting to get a diagnosis in general sometimes. And it's upsetting to have all this stuff laid out like that. So I think it really depends.
That's true too. I see that in my own family situation with my son. So that's a really good, clear answer. Thank you for that. Do loved ones of BPD that develop PTSD absorb self-mutilation symptoms too?
BPD develop PTSD. I see the question. Okay, so yes. Okay, so again, difficult to answer because we don't have too much data on that. What I can say more generally, self-injury does sometimes happen in PTSD. It is not as common in PTSD as it is in BPD, but it is something that can happen in PTSD. So that depends. So it's not completely uncommon to see somebody who has PTSD engage in self-injury. It is also not the, I wouldn't say we see it more often than not, though. Most of the time when people have PTSD, they do not self-injure. But most people who study PTSD or who treat a lot of people with PTSD will tell you that they've seen that before.
Okay.
Yeah.
Common.
Yeah.
Okay.
Okay, I'm going to jump in with
Go ahead, Doreen.
question here, which is that a lot of people have been asking about the genetic component of BPD. Maybe you could just very briefly, I know it's not specific to this topic, but maybe you could address that.
Yeah, happy to. So, there's a growing body of research that's looking at genetic contributions to BPD. I'm not a geneticist, so there's definitely other experts who can speak to this better. To my knowledge, they have not identified, this is the BPD gene, but there are people who are starting to study the way these emotion processes and difficulty changing emotions might run in families, and that there might be some kind of vulnerability towards these difficult emotion processes that perhaps when they interact with some kind of stress, then kind of go on to lead to borderline personality disorder. So I don't think that we have conclusive evidence of that. There is some study that supports the idea of some kind of genetic contribution, but I don't personally know that I could say, it's X% of BPD is from genes. Maybe a geneticist actually feels like they can answer that, but I don't. And I don't think it's common knowledge in the field.
Great. And I also have seen a couple questions come up about the relationship between BPD and narcissism, whether it's a trait or a common comorbidity with narcissistic personality disorder.
Yeah, totally. Same answer, right? Personality disorders highly comorbid with each other. They often go together. They get stuck together a lot. So BPD is associated with narcissistic personality disorder. Again, not the most common thing, right? Probably the most common is like depression, anxiety disorders, PTSD, but these, what we call personality disorders, whatever that means, right? Because the term is kind of confusing. There's nothing wrong with your personality. But what we call personality disorders, they are sticky. They stick to each other. So they often do go along with each other.
And I'm seeing a lot of questions. I'm trying to sort of group them more generally. People are asking about how to improve a relationship when their loved one with BPD expresses a lot of anger and violence toward them. And conversely, the person with BPD is sort of withdrawing and isolating. And they can't reestablish a relationship, even though they may want to reestablish a relationship with them.
Okay, well, let me first plug Family Connections once again, and the work of Sashbear and the work of NEA BPD, I think, who are really trying to help answer those questions for loved ones in a really concrete way. So I highly recommend for people who are interested in Family Connections groups to really pursue that. Because I do think that one thing that Family Connections does is it teaches a lot of concrete skills for how to respond to intense emotions. I really want to encourage loved ones who feel like they're in a situation where there's violence to really also be thinking about their own safety and well-being. And so doing what they need to do to feel safe as well in those kinds of situations, I think is generally important. Again, I can't speak to a specific personal situation. This is sort of more general ideas about those topics. And I think in general, when we see high levels of anger, I think that there's lots of skills that are taught in Family Connections that can help diffuse that and help communication improve. Validation is one that comes to mind, right? Like thinking a lot about validating emotion is pretty critical, we think, for getting emotions down in general, but not at the expense of somebody's safety. So it sounds like what makes sense for people who find themselves in those situations might be to think about Family Connections, and also maybe think about getting their own individual support to help them manage, their own reactions, their own distress they're feeling, and their own safety.
Okay, thank you. I know we are right at 8 o'clock and we don't want to keep people too much longer than we said we would. And I know we also don't want to keep Skye too much longer. So I think I have two other questions that have come up a lot that I think people would love to hear an answer to. One is kind of following up on this idea of genetics as a component leading to BPD. And so the alternative to that might be, does the family environment contribute, and how does the family environment contribute to the development of BPD? And specifically, there were a couple questions about adoptive families and whether adoption plays a role in there.
So the family environment, I mean, the leading theory of how BPD develops does suggest that BPD develops from a transaction between a biological vulnerability to some kind of emotion problem and what we call an invalidating environment. Now, this is an environment that maybe doesn't have the same emotion problems and on purpose or accidentally can respond to emotions by punishing emotional expressions, and sort of invalidating, communicating what they don't know always makes sense. There's a lot more to say about that. I'm mindful of the time, so I'm just really briefly mentioning that. And I will say that the invalidating environment could be a family environment. It could also be a broader experience. It could be how some experience school, right? They could be invalidated there. It could be, you know, being a queer child in a very heteronormative world could feel invalidating, right? So sometimes that it does involve the family environment, but it's not a one-to-one relationship. So invalidation can come from many places. And the idea is that they transact over time to elicit emotion problems that then lead to BPD.
Great. Thank you. You worded that so well. And I can also just add that this is a topic that we touch on in Family Connections and actually spend quite a bit of time delving into and asking participants to reflect upon as they take the program. So if you haven't taken Family Connections and this is an issue you're wondering about, then that might be a good place to start. Another question that we hear a lot in Family Connections that I will just ask for your expert response to is what to do when the person with BPD will not seek treatment or will not seek diagnosis, because that of course impacts the relationship when you are the person trying to help them by leading them to diagnosis.
Yeah. I think I would encourage loved ones to seek out their own individual mental health services in those contexts to navigate the frustration or despair that can be associated with that, because they're in a difficult situation. It's very, very hard to treat somebody who doesn't want that treatment, you know. So I would just really, I mean, my thought is a general principle is to really, I'd be really hoping that loved ones can care for themselves with that difficult situation.
Great, thank you. So I think we will end it there. If anyone has a question that they would like Skye to try to address, you can, if you type it into the Q&A with your name attached to it, then we will try to get some of the questions answered by Skye after the fact. If it is an anonymous question because you don't want to put your name into the Q&A right now, you can send your question to me, which is fcprogram@sashbear.org. And Kathleen, maybe you could type that into the chat for people. Just fcprogram@sashbear.org. Also, if you're interested in the Family Connections program, you can email me at that address, or you can go to our website, which is sashbear.org. Once again, I want to thank Diane Boca and the Ashley Boca Mindfulness Foundation for their assistance with promoting this webinar, and they can be found at abmf.charity. And of course, thank you so very much, Skye, for being with us here tonight, Kathleen and Kathy for supporting me in moderating this. I'm sure you have given a lot of families a lot of hope as you have spoken about these very important topics, and they have learned about the really important research that you're doing. So thank you again. Was there anything else that you wanted to add, Skye, as one last word?
I hope you have hope, because I have hope too. So thank you so much for letting me be here.
Great. Thank you so much. And thank you everybody who was able to be here tonight. The recording will go on the Sashbear YouTube channel, and we will provide a link to it on our website. And that probably will happen in the new year, because please keep in mind, most of us are volunteers. And so we will get to it when we get to it, and hopefully sooner than later. Thanks again, everyone. Bye-bye.
Bye.